Welcome to the episode 46 of The Smartest Doctor in the Room. I'm your host, Dr. Dean Mitchell. Hippocrates has been famously quoted, especially by the functional medicine and holistic doctors, that all illnesses begin in the gut. Today's podcast guest, Dr. Valerie Taylor, may be the perfect person to answer the specific question: how much of our mental health is affected by our microbiome? Dr. Taylor is a professor and department head of psychiatry at the Hotchkiss Brain Institute in Alberta, Canada. She is internationally known as an expert in this area of the brain-gut connection. I think she's unusual in this aspect that not too many people who are psychiatrists are interested in poop. That's what kind of makes her special. I did have a prior podcast on the power of poop with Dr. Ari Greenspan several months ago, who's a gastroenterologist at Mount Sinai. And, it was a very interesting discussion, but obviously a lot of it was focused on, infections in the gut and issues with that directly with the gut. But here we're going to be talking about how what's going on in your microbiome and assessing your stool may be telling us a lot more about your mood and whether you have a mental illness. And just a few facts before I bring Dr. Taylor in. The human gut has 100 trillion bacteria. So sometimes you have to think, what are they all doing there? The other thing is there are 3 million genes that help build molecules to help us digest food, make vitamins, such as vitamin K, and to keep bad bacteria out of our system. And finally, this is, I think, super important. The bacteria in the gut make 90% of our serotonin in our body. And almost everyone, knows serotonin as that neurotransmitter that, again, there are so many medications that are given to try to help boost your serotonin to keep us calm in a better mood. So with these facts and looking forward to a lot more answers, I'd love to welcome Dr. Valerie Taylor to the podcast.
Thank you so much.
Okay, so let's get down to business here a little bit. I came across an article in Discover magazine, which I really like a lot, where they quoted you on in an article that was called Gut Feelings. It was by Elizabeth Svoboda, which was very interesting. And just initially in the article, they mentioned that it wasn't until, believe it or not, the late 2000 that an Irish scientist, I believe John Cryan, made one of the initial discoveries about the gut microbiome and this brain connection. And he did, I think, research in mice, showing that they had less diverse microbiomes. So I want to ask you how you got involved and where you think, some of the compelling research just even began. Because obviously we could go back to Hippocrates, but I don't remember him being published in the New England Journal. I think he was a little ahead of his time. So where did we begin with this?
I think he was ahead of his time. And I've been in this field about 10 years, but this is actually, it's kind of new and old. And so if we actually, I would say about 100 years ago, that this was actually one of the prevailing theories in mental health, the whole concept of auto intoxication, and basically that stress and low mood were burnout were associated with whatever was going on in your GI system. And actually,
Hmm.
Dr. Kellogg, who made many of the breakfast cereals, or his family made many of the breakfast cereals that some of us ate this morning, he actually ran Battle Creek Sanatorium. And one of the things that they did there
Wow.
was that, for the well-heeled of the day, they got stressed. You go there to relax and to kind of de-stress. And one of the things that they did was they fed everyone a really bland diet. That's where our bran flakes, I guess, started
Yeah,
out.
he made out very well from that, by the way.
Yeah, no, that was probably one of the first times, we talk about
Interesting.
pharma involvement. This is one of the first early ideas about commercialization and
Yeah.
taking things forward. And so, the theory then was that, this brand diet kind of regulated everything, kind of fixed your GI system, and you weren't going to be stressed. And so, of course, this concept has been around for a while, but as unfortunately things tend to go in some.
Right, because they become medications, and obviously with all the SSRIs that became available, that was the big explosion. That was the big breakthrough in psychiatry. So what got you interested when pharmacology became obviously the dominant mode of therapy for patients with depression, anxiety, and even now schizophrenia? What led you to go in this direction? I'm just curious.
Yeah, so my research started out sort of in medical psychiatry, but more looking at obesity, diabetes, cardiovascular disease, and how that manifested itself in patients with mental illness. Because way higher rates of cardiovascular disease and all of those things in individuals who have mental illness. And so that was what my focus was on. And of course, that leads you back to looking at the medications, because clearly there's a link between some of our medications and weight gain. And so the whole
That's
concept
right.
of we need better medications was sort of where my mind was going. And then at the same time, I just anecdotally, I had two patients who had been quite unwell for a long period of time, and they'd pretty much not responded to anything. And both of them, separate of one another, needed antibiotics for two separate things. One of them had a minor surgical procedure, needed to take antibiotics afterwards. One of them developed pneumonia, needed antibiotics, and both of them, about a week after starting the antibiotics, their mental health symptoms that have really not changed in 10 years or had both been profoundly depressed were cured. Like they were completely well. And they
I'm
both,
taking a course of antibiotics.
yeah, and
Wow.
they both came into me and sort of said, what just happened? Do you
Wow.
the antibiotics or not? I was like, I
Right.
actually have no idea. And of
Wow.
course, in about 2 weeks after starting the antibiotics, both of them became ill again once the antibiotics stopped. And then one of them, we actually did try a re-challenge, and we said, okay, let's try this again.
Yes.
And the second time around, nothing happened. And so
Mm,
they were like, what is going on? I'm like, I don't know,
mm,
but I'm going to try to find out. And kind of
mm.
rest, as they say, is history. And so I was
Yeah,
at McMaster University at the time, and they have a really great microbiome program focused mostly on the GI system, and they do a lot of animal work. So I started doing work there and sort of learning about this association. I moved on to the University of Toronto, where we set up the first fecal transplant program for, which is interesting, for illnesses outside of the GI system. So to try to
Oh,
treat illnesses, not just C. diff. Fecal transplant is actually recommended for C. diff infections now, and it's being looked at for other GI illnesses. But we started looking at it for other things, and then ultimately came here to the University of Calgary, where I'm the department head, where they have a fabulous microbiome program, and we're trying to really get into mechanisms and
oh,
understand
that
why.
does sound interesting. And yeah, it's sort of your career led you along to this moment where things are really coming, to a head. So yeah, that leads me to my next question, what really interests me. And I'm just staring at a picture in the article from Discover that shows the intestine. And the gut is a huge immune organ. I don't think people really appreciate how how long our intestines are. Although, in going from our stomach all the way from the small intestine to the large intestine, do we know what areas might be really key in the microbiome of, and again, this whole idea of the good and bad bacteria within the intestine? Because again, what I've read is that the small intestine is supposed to be sort of a sterile environment, is if that's correct. And it's the large intestine where a lot of the quote good bacteria, bad bacteria, garbage, stool, it's like the garbage bag of everything. Is that where you focus? I mean, do you
That
differentiate
seems to be sort of that's where the money is, so to speak.
in the large intestine?
Yeah, that seems to be the area that's the key. But clearly, there are people looking at a variety of different areas within that whole system and seeing how, if it's possible to, because sometimes that area is a bit harder to access. And so,
Yes,
seeing if
yes, it is hard.
changes in one space will alter things in the other. But as you said in your quote, we think, or in your opening, we think about 90% of all illnesses can be tracked back in some way to your GI system. And so we're hoping that manipulation predominantly in the large intestine will really have an effect on a variety of different things that are not intuitively linked to your large intestine.
Hmm. All right, let's get into, to me, clinically, which is important, also the messy stuff. Back in the day, several years ago, people would bring in these reports on stool analysis, and honestly, I really didn't know what to make of it. I was like, I had not really. I only the time I really ever ordered, and my background's in infectious disease, immunology, and allergy, and the only time I ever ordered stool cultures, or analysis was when patients traveled overseas and we were worried about ova and parasites and things like that. But now, there's a company here in the United States, Genova, that they're doing, people are regularly getting stool analysis. And, I get back reports about, butyrate levels and, um, I think what's the other one? Calpectin, which I look for if people have possibly Crohn's. So what do you, I guess I know you're doing research, but also clinically, what are you looking at when you're looking at the stool? What do you, because I know supposedly like if, I guess if they have someone has a lot of the good bacteria, quote bifidobacter, they produce. I think is it a lot of butyrate? Am I
Yes,
correct
so
in that?
butyrate is a short chain fatty acid, and so it's one of the healthy byproducts of kind of good bacteria in your gut breaking down fibrous foods. And so, we need a lot of those bacteria, and so they produce butyrate. Butyrate is really important, does a lot of things, especially in your brain. So butyrate is sort of one of the end products that we think actually might be part of this gut brain association. It helps with cognition. It's involved in sort of microglial, which are the cells in your brain, proliferation and support. And so butyrate is something that's really important. But those kinds of reports that you would get from companies like Genova are very different than the stuff that we'd be looking at. And
Well, so how reliable are that? I'd love to know as a clinician because I deal with a lot of holistic medicine and I deal a lot, I find myself in my own practice, like helping people get what I call a healthier gut is critical in getting them better from issues like chronic fatigue syndrome that I see and candida overgrowth. So what, can you just give me a little insight? Do you think they're helpful or they're limited right now, those like stool analysis?
Well, I mean, if you do stool analysis and you see blood, that might mean that there's a
Well,
tumor.
yes.
So those are
Right.
really
Right.
important things. I think other than that, sort of looking at levels of butyrate or other things, kind of without really understanding what else is going on, they're not necessarily so helpful for really
Okay.
identifying illness. It's sort of like those ancestry DNA where you kind of put in your
Right.
stuff
Right.
where you cite, you send in a bit of your spit and they come back with your
Right.
ancestry history. It could be really, it's interesting to look at. How actual meaningful is it for
Yeah, just to look
things
at
like,
data, because also some of these companies do like neurotransmitters in the blood. I've seen from other holistic doctors, which I don't do, because to me, neurotransmitter work at such a localized level. How could the blood really be capturing that? But I just wasn't sure, and I really want to hear from someone like you whether the stool could be a beneficial way. I mean, again, sometimes, I always tell people this podcast hopefully makes me smarter because I just recently diagnosed a patient, unfortunately, with uh, Clostridia difficile toxin. She had had 2 rounds of antibiotics, first for a dental infection and then for a urinary tract infection. And then over a period of 2, 3 months, she lost like 30 pounds. She was having watery stools and it wasn't picked up. And then I finally said, I think we should order, the stool assay on you, and it came back positive, and she's getting treatment now. So um
and that's absolutely how these things can be useful for specific parasites and those kinds of
yeah.
identification. Absolutely.
Okay. Let me ask you this, because this is really, of course, what I like to call, was it the $90,000 question? So many of the studies that I was looking even in the Discover article by you on where you were quoted, and one right before you, which was actually interesting. So many of these studies are done on mice. What is the correlation to humans? And I mean, do you feel at this point that there's enough evidence to really strongly indicate that the bacterial changes in the gut have a strong effect on people's mood and some of these serious mental illnesses?
Well, I may be the wrong person to ask because that's the whole field of research that we're doing is trying to translate this animal work into humans. And so we've taken it, we're doing human first research. So
Well, I like that, but what you're saying, why would you be the wrong person? Because
because I think it is time that we started looking at.
yeah, right. Because people say, look, we know, again, in my background over the years in immunology, there's a lot of things you can do with mice. And it's interesting. And sometimes it does translate, but a lot of times, it's not like doing in monkeys or something. There's and then of course, now when we're talking about the brain, which is, there's no other animal that has, our type of frontal cortex and increased, brain mass, that it could be just a whole different ball game. So,
Absolutely. And that's not to downplay how important the animal work.
yeah.
However, I mean, I wouldn't be here if it weren't for some really compelling animal work that sort of made me go, what is happening here?
Yeah.
But now trying to our focus is to work with our preclinical colleagues and to kind of see what happens translating this stuff into humans to understand what's going on in people, and can we actually manipulate your gut microbiome in a way that actually is helpful for human disease. And that can't happen without the animal research, but it needs to happen in parallel. There've been, unfortunately,
Right.
a couple trials of different probiotics and compounds that really seem to make a difference in mouse models of illness or depressive like behaviors in mice. But unfortunately, when they've
Mm.
been translated into humans,
Yeah.
they
We,
don't
we
seem
need
to
we
be
need a
much
little warp speed.
difference.
Yeah, we need a little warp speed program for this kind of thing, not just for the vaccine, although that's very promising in itself.
Priorities.
All right, so let me ask you about the options to change the microbiome. Um, Obviously, there's like probably two things that come to mind: the fecal transplants, the work that you're doing, and probiotics. So, could you tell us a little bit? I guess the people kind of cringe sometimes when they hear about fecal transplants, but on the other hand, I've had patients travel to England to get fecal transplants for arthritis conditions, a lot of different things. So people, to get better, are willing to do a lot of things. So I know, and there's different ways of doing it. I think there's pills, there's obviously enema. So tell me, because you're again, this is your area. What's your experience, what you're doing in your studies and finding of interest?
So we've been pretty lucky that we kind of found some funding agencies who are willing to take some risks on pretty novel clinical trials. And the first was a Stanley Medical Research Foundation, which is out of a U.S. based uh, granting agency. And we started the first clinical trial focused on fecal transplant for mental illness. Now I'll say it's fecal transplant given the old-fashioned way, so it's via colonoscopy.
Right.
And that study is looking at the depressive phase of bipolar disorder or manic depression. And when we first got funding, certainly my colleagues were like, there is no way in hell somebody who is depressed, who does not need a colonoscopy, is going to volunteer for one. That is not something depressed people would like to do, is kind of say, what's going to make me feel better? A colonoscopy. But I think for patients, this makes sense to them. Like, they
Mm-hmm.
really feel that there's a link between their GI system and their mental health symptoms. And so
Mm-hmm.
they were actually like, yes, I've been telling this to whoever will listen for years, that when my depression gets worse, my GI system gets worse, I don't know what's causing what.
Right.
And so they found this area really fascinating. So we've actually had a lot of interest, and we're hoping to conclude that study in 2021. So I'll loop you back in when those results come out. But certainly the preliminary data thus far has actually been really positive, so much so that we started a second study that's actually happening here at the University of Calgary, and it is fecal transplant via capsules. And it's actually funny, depending on, it says a lot about a person, I guess. Some people find the whole concept of fecal transplant via capsules way more disgusting than the idea.
Yeah, yeah, but either way seems pretty tough. But if I wasn't well, but how could that even possibly work with a capsule? I mean, because it stays protected till it gets, I guess, activated in the intestine. Is that the thinking?
Yeah, absolutely. And the reason that we went to the capsules was because there was some really strong work, again, looking at the C. diff infections, and they compared treatment of C. diff infections with fecal transplant via colonoscopy versus fecal transplant given via colonoscopy with fecal transplant given by the oral pills, or the capsules, so to speak. And
Mm.
they found that the two treatments were equally as effective. And so for C. diff, didn't matter if you got the sort of enema colonoscopy formulation or if you took the oral pills, both worked to treat C. diff. And so,
Well, what interests me too also is this, because again, from what I've heard, I mean, I guess in the early days, and you heard these stories, and some of it obviously comes from the veterinary medicine literature, but it's like you got to find the person with the right kind of feces. And now I think they have stool banks, right? Where apparently they're screening them, because I think it's potentially, obviously, there's probably risks and dangers, and people are just getting someone, friends or family they trust, and getting a transplant from them. I mean, it's not like a liver transplant. It's a different type of situation.
we try to kind of tell people to think of it just like you're getting a blood transfusion, and kind of would you just go to some random person and get
Right.
take a
Right.
blood transfusion in a back alley? Of course not. And so this is the same thing. It's biological material.
Right.
Unfortunately, about 2 years ago now, there were two deaths in the US from people who received a fecal transplant that the individuals were immunocompromised, the fecal transplant hadn't been properly screened, and two people got infections and died. And as a consequence,
Mm.
both the FDA in the US and then Health Canada, which is our regulatory body in Canada, shut down all of the fecal transplant studies, ours included, until everybody gave them their safety data and said, what are you doing? We need to know that this is safe. And of course, most of the university programs were meeting and exceeding the safety standards, but there's a lot of people who are kind of doing this privately and aren't adhering.
Right, right. That sounds right. As I said, there's some clinics I know opened up in England. I don't think really in the United States that I'm aware of, because people were usually going abroad for, or Germany, those kind of places, and getting it done. The other really, really tricky thing to me too would be, I could understand, I guess, at a certain level, a person has ulcerative colitis or some, again, inflammatory bowel disease, and they get, fecal transplant from a quote healthy donor, somebody who seems to obviously be free of that disease. But to extrapolate, it's like you take a depressed person or someone with bipolar disease, and you say, okay, I'm going to give them um, a fecal transplant from just a healthy person. Do you know what I'm saying? Like, let's say, as far as like, how does it, their mood and their, it's such a different thing. It's
Absolutely. And these are one of the few clinical trials we're finding the kind of the healthy controls is actually harder than actually finding the participants. And so,
yeah.
I would say, I'm pretty fortunate in that I have no allergies, I have no chronic illnesses, and I take no medications, and I'm not healthy enough to be a donor in our
You're
field.
not healthy enough to be a donor.
These
Why?
they we screen these people so thoroughly, and
Wow.
it's not just that the donors have to be kind of extremely healthy. There cannot be any major mental illness, physical illness, any
Mm.
first degree relatives. And
Oh,
so
wow.
so
Wow.
these are hard to find people, and so when we find them, we try to we treat them well so that they want to keep donating and being
Well,
involved in the process.
I'm sorry. I'm going to jump into another question because I'm looking at something on my notes here. This has got to be really rough too. Like I know a lot of times in my field, I also work in the field of food allergy, and unfortunately, in studies, to see the real results of something, it has to be, double blind, placebo controlled. Meaning, unfortunately, sometimes these children are getting placebo and are still being challenged with peanuts that they might be allergic to. It's really a really brutal thing. But does that go on with these kind of research also? Like a person gets a colonoscopy and they don't know, they might not be getting the actual fecal transplant, or are these open sort of studies?
No, we're trying to do this right. So we actually have their randomized controlled double blind studies, and so
Wow.
people show up and they have to bring in their own stool sample, and so they don't know if they're getting sort of the processed intervention stool from the healthy donors or if they're getting their own back, and they're
Oh, so that their own stool is their own is essentially the
uh,
placebo. That makes sense,
yeah,
right?
and so they don't, and the same thing with
And
the
same thing for the clinicians. They don't know which ones that the
oh nope, not until the
wow, that's very impressive. Yeah, this is people don't appreciate how hard sometimes doing research is. It's that's why we do. I think also, and again, that's why I was excited to have you on the program. You know, what I tend to find, and I love reading the newspapers, the New York Times, and they'll sometimes have a science section, and then you see these headlines that come out that seem so promising and sometimes are misleading. They get patients' hopes up. And they have to, really, it takes sort of really a doctor or someone with clinical, or research experience to appreciate what a study is saying, how many people are in the study, how rigorous was it, because anybody in a very small trial, especially if it's open, not blinded, can get the results that hopefully they're looking to get versus what really is. I want to ask you too. There was a study, again, was quoted in that article in Discover, that I guess there was a Japanese study that's showing bifidobacter seemed to lift depression. Is that something that you've come across?
absolutely. And so that was a study looking at the probiotic, and the work on probiotics, unfortunately, is is interesting, but most of it is not completely well done in that many of the studies looked at either small sample sizes, followed them for a couple weeks, or they actually didn't look at sick people. And so they kind of took people there, if you look at the study, it's like healthy athletes volunteered for this study on depression. And after taking the probiotic, they were still healthy, happy athletes. And so this probiotic made them healthy and happy, but they were healthy and happy before it started.
Yeah, that's so sad, because when patients all the time come to my office and ask me what's the best probiotic to take, and my answer to them is, unfortunately, I mean, I think we again, and I think a lot of experts will say we don't really know, as you're saying, but that probiotics is in its infancy, really, as far as our knowledge, and most of us tend to know that bifidobacter and lactobacillus are supposed to be good for a lot of reasons, but you would think because it's much easier to do than a fecal transplant, there'd be a lot more really rigorous research, clinically showing the benefits and for specific conditions. But you're saying what I think I already know, that there really isn't very much,
No, that Japanese study was probably one of the few that actually
really.
looked at people with depression, and it was pretty positive. So I think that there's good reason to think that there might be some signal there, but certainly there's not enough to say, stop if you need an antidepressant and you feel bad with that one, you probably can't stop it and replace it with a probiotic at this time. There's no good evidence to say that it can certainly replace other treatments for people that need it. Is it good if you have depression and you're well to help keep you up? Perhaps. And if you can afford them, maybe that's not a bad thing to do. I'd say, in giving advice around taking a probiotic, just make sure that kind of the probiotics are labeled, that it tells you the genus and the strain so you know what you're taking, that it should be kind of 10 to the 9 colony forming units in there. That's what most of the research has been focused on. And so there are things to look for to at least make sure you're not going to take something that is unhealthy. And then after that, I'm going to see if it makes you feel better. But
Do you take a probiotic?
I don't because I
I don't either.
no, I eat a lot of
Fiber.
I eat a lot of fiber and sort of the fermented foods, the functional foods that we know kind of
Hmm.
help make the bacteria that we already have happy. And so
Yeah, I think that's an important thing, because again, also they were mentioning, like you were talking earlier about butyrate, and that seems to be the kind of the good that's produced by the bacteria. I can't even pronounce these bacteria, Phacobacterium and Coprocoses, right? They should change the
bacteria
names.
and
They got to change those names. But but to get that, I mean, again, it's almost like you really want to see what I tell my patients a lot too, by the way, because when we're going west, obviously high fiber plant-based foods are very good. Um, I like a lot of times when patients have like ground flax seeds, because I always say it's good carpeting for the gut. The bacteria need those essentially prebiotic foods, so so the good ones survive. Is that a good way of putting it?
that is absolutely the way to look at it. Yeah.
Yeah. So, because again, and also getting, the biggest thing again, which I didn't appreciate. Again, remember, I always tell my patients this too. I trained in immunology, and especially in the AIDS epidemic in the late 1980s, and we were trained that about your bone marrow produces the B cells, your T cells from the thymus and all that, and that's like the super important thing of your immune system. And then the functional medicine movement, holistic movement, I have to give them credit. They kind of brought people back to saying, your gut is important, what you're feeding is really important. And now I tell patients, yes, I mean, by having a high fiber diet, because the worst symptom I worry about with patients in a lot of these cases is constipation. When they're constipated, I know that they're just building up all these bad bacteria. They're not releasing toxins. And I have to do anything I can. It's one of the few things they rarely taught me in all my medical training, how to deal with constipation. I've gotten really good at it now, but it's something I wouldn't have been aware of. And I think a lot of doctors don't appreciate. They're like, oh, just take some Metamucil or take a laxative, but that's not really, I think, the answer.
Constipation and good sleep, if you can get those two things under control, everybody's going to feel better.
Yeah, it's true. You'll see a big smile on their face. It'll be like the Amazon smile. All right, I have to move on to something else that's a little more serious. And again, I don't know if this is in your expertise, but I want to ask you still about it. and it's about autism.
Mm.
And it was interesting because the article right before the one I read on yours was an article, very interesting. I'll mention some of the scientists that were involved. Um, it was called bacteria in the brain. And the article mainly focused on autism. And I just want to give my listeners a preview of this too. I was at a medical conference. It was the functional medicine conference in New York, probably about 6, 7 years ago. This all seems a lifetime ago now with COVID, but I was at a big meeting, and David Perlmutter, who's pretty kind of famous neurologist, brain, and he's taking a lot of criticism, but he's actually a really bright guy, and I think likes to do serious work. But he had this great presentation. He was just a super present, at speaking. But at the end of his talk, I wasn't expecting. He puts up a video because again he was dealing about this whole thing about the microbiome and everything. He puts up a video of a boy who probably was about 13 years old that was autistic, and you could see he was just not communicating and just I guess a lot of the behaviors that are familiar with autism. And then he showed, subsequent to that, a few months later, another video. The boy was like, I would say 70-80% interacting with his family. It was just a different kid. And again, as I said, I take Dr. Promer as a serious doctor. And he said, what was the difference in this case? He says, again, this is anecdotal because this young man had a fecal transplant. And in this article on in Discover on bacteria in the brain, and there's a researcher, Sarkis Mesmanian, you may be familiar with. But they had a boy named Ethan Woods, who, again, it was just a case study, but he was 7 years old, and he has autism. But again, also what I think a lot of people don't appreciate, I'm not sure even psychiatrists, that a lot of these kids I think like 70% of the kids with autism have GI symptoms like bloating, diarrhea, and cramping. And again, in this case, he had a fecal transplant, and it made a world of difference. So with autism being such a severe condition, I mean, 1 in every 59 children in the US are being diagnosed with it. What's your thoughts about the fecal transplants for these kind of patients? Does this deserve a lot more attention and focus?
Well, I mean, I think clearly it's worth investigating, and I think there was a lot of excitement. There was one study looking at fecal transplant in individuals with autism, and to your point, the primary indication was for the GI symptoms because that is a significant uh, part of the presentation for a lot of people. But they also looked at a measure of kind of how their autism symptoms were doing. And they followed them out. The last time I saw was up to 2 years out. And the difference in the symptoms of autism, social interaction, other things was profound. And this study got a lot of attention. But the problem was, as we discussed earlier, A was open label and B only looked at 11 kids.
Right.
And so I know that there's a
Why do
number.
you think they're having trouble enrolling more children into this? Is it
I don't.
funding, or is it because
Well,
it's not from a drug company,
yeah,
obviously, at this point?
yep. Part of it's funding. I think it was, and they said it's clearly we didn't know this was going to work so much, and so you don't want to do
Mm,
a lot of kids until you figure it out.
right.
So I know that that group is doing a larger study. There's a couple of other studies underway right now to look at it. The other part is, however, and this is the piece where we have to regulate. Here in Canada, there was about a year ago now. An alternative health practitioner, I believe it was a chiropractor, but I may be wrong, got into a lot of trouble. He was charging families who had kids who, who had autism, he was charging them to take the kids down to Tijuana to get a fecal transplant. And of
Mm,
course, you know, those things, like there's about 8 different things wrong with that.
right.
And of
Right.
course, he was lost his license, was shut down. So we also have to be very careful about,
Right.
lots of risks of infections, and we don't know exactly what's going on. And so I do absolutely think that we need to investigate this further. We need to do more trials and better trials, and we're hoping to actually partner with some groups perhaps in 2021 and have a look at this ourselves. And so, is there reason to get excited? Absolutely. Is this going to be the cure all for autism? I'm sure not. Can it help some people? I hope so. But
Are
we
there
need
any centers, in the United States that you know of that are really, that you would recommend if I had any of our listeners, had a child that would seriously consider this?
I don't know. you know what, I can Google for you. I don't know the centers that are
So,
looking at.
so it's not like some people you're doing multi
No,
center studies with or anything like that.
they're still pretty small. I would say only work with an academic center because you need to
Yeah,
know that the safety things have been taken into consideration, that the stool has been cleaned and screened, and you're not going to make it
right,
worse instead of better. So make sure that you're working with a place that is following FDA regulations. And you know, there are pop-up places, and just think about it as a blood transfusion. When you go to a strip mall and get a blood transfusion from some little hole in the wall place, no, so you probably don't want to get a fecal
right.
transplant. And
And the other two is also I have to ask you, again, like I had a patient who went, as I said, to England for a while because he had very bad overgrowth of candida and issues. One of my toughest cases who were just barely trying to help get, to make it through every day. But like he went to England also, and he got like 10 transplants. So it's like, I mean, like you were just making the example of like with transfusions. Do they need that many transplants? I mean, is it like once, why would you have to have consecutive days in a row versus you just get it up there and let it see what it does? I mean, does that make sense, or does that just sound like you know,
I mean, it makes sense in that we don't really know. So with our kind of colonoscopy fecal transplant, it's kind of a one-stop shop. People get one treatment. They have a
right?
bowel prep beforehand, cleans them out. They get one treatment, and then we're seeing what happens. Is that going to be enough to keep somebody illness-free forever? I would highly doubt it. And so I would
But
assume
you
that.
would you expect within 1 or 2 treatments just to get a response. It's not like you need 10 treatments to see if you're going to get a response, or
No, certainly not from a colonoscopy perspective. And there's also lots of risks of 10 colonoscopies. It's
yes,
not
right,
a benign
right,
procedure. With the oral, and that's part of the reason, that people are looking more into the oral preparations. A, it's safer. There's not as
right.
much risk as with a colonoscopy. And you can give, doses over weeks and months. And so that's actually with ours, that's what happens. People get kind of a few days of a number of capsules, and then every week they have to take a few more, so it kind of keeps them going over a course of 12 weeks, and so it's a slow steady change. And that's also part of the research, is if we find out that this works, and then kind of what is it's dose finding, like it's the same as with a pharma study,
Do
what
you
is the
have
right amount.
Yeah, you mentioned earlier about the dramatic cases with the antibiotics that opened your eyes to this. Do you have any like sort of dramatic cases or anything that sticks out in your mind from doing the transplants or the probiotics with a patient that really just like unforgettable?
You'll have to invite me back next year because the studies are still blinded.
Okay. Oh,
Can't
so you don't
talk
know.
about the results
Okay.
until the study.
Okay, no, I will invite you back because I think this is so important. And I think people need hope more than ever. I think that as you titled in one of your editorials, which I'm looking right at now, the microbiome and mental health, hope or hype. Of course, we want to hope. It's hope and not hype because we just don't want to disappoint so many people. And I want to get back to one other thing too, which I find fascinating. Again, in my background in immunology and allergy, that affecting the microbiome in pregnancy has to be such a dramatic thing. I see patients with severe food allergies, children and adults, and sometimes one of the most striking things I've seen in multiple cases now is that the mother would typically tell me that she's got two other children that are healthy, no food allergies, but with the child that had the food allergy, she had gotten an illness like a urinary tract infection, or she was not even sure at the delivery. They gave her antibiotics, and that's in several of these cases, that to me was the clear cut, because the child had food allergies very quickly. And I think by obviously dramatically changing the microbiome, I think for sure you obviously change the immune system. And I think that's why I've had other people on the podcast about this. I think that's why we're seeing this epidemic of food allergies like we've never seen before, because I think antibiotics were just, really used quite extensively for quite a long time, and probably even in our food supply. So I guess I don't really think it's a stretch to think that, this alteration of the microbiome from antibiotics or anything else in our environment can be playing a role in mental health.
But we know that after a course of antibiotics, your microbiome is kind of takes about 3-4 months at least to kind of reset itself and to go back to what it was before the antibiotics started. And for our healthy donors that we have in our studies, that one of the criteria is that they cannot have used antibiotics in that minimum the
Interesting. Wow. See, that's really powerful. I think people have to hear that. When I know that a patient has to go on antibiotics for some reason, whether it's in my own practice or if they call me because they saw another doctor who said, look, you have a dental infection, you have a urinary infection. I tell them typically also to go on a probiotic. And also I put them on a very mild antifungal like nystatin, which is what, from what I understand, they used to do many, many years ago. It kind of fell by the wayside because again, just trying to sort of keep that balance of the microbiome, during a period when you do need, um, you do need intervention.
Yeah, and I mean, and there's obviously a balance. Part of our work is trying to figure out what that balance exactly is. And for the um, autism studies where they're trying to get the healthy donors to come from kids, because they want them to be age matched as close as they can. They want children who have never taken antibiotics. And
Wow.
certainly,
How are you going to find that? That's very, very hard.
certainly kids of
Far out in the rural areas of Saskatchewan or someplace you found there's no.
certainly kids of physicians, because we're very loath to start an antibiotic unless clearly it's necessary. And my
Yeah.
poor children have to be bleeding out of their eyes before I take them seriously. No, that's okay. You're going to be okay. And
Okay.
so because we understand that you have to be judicious in the use of some of these things.
Um, okay, so as we come to sort of a conclusion of this terrific, interesting podcast from my perspective, is there anything else you'd like the listeners to know? Something that they should be thinking about, be aware of, that comes to mind?
You know what? The reason that I'm doing this research is I would love it if this really makes a difference in terms of moving things forward for mental health treatment. But I think it's also equally as important if we don't find anything, because I think then what it will do is tell people to kind of stop focusing on this area. Tell scientists, look, doesn't seem
Right.
like this translates, and let's go look elsewhere. And I think both things are equally important. And this may not be the magic bullet. I'm sure it's probably not going to be the only magic bullet. And so be skeptical, and don't get taken advantage of. Don't stop things that you already make you feel good because you think that this is healthier. But fingers crossed. And when somebody asks you to volunteer for a research study, if you can do that, good
Yeah.
science comes from people.
Those are good answers. The one thing I would add, though, because I like your thinking. I mean, that's one of the things I always like to bring out to my patients too. I'm a conventional doctor, but I also do holistic. I try to be open-minded, but you don't ignore practical things. But I also don't want to bet against Hippocrates. If he said almost all illnesses come from the gut, some of those early early doctors, physicians, healers, whatever, they had some probably mystical insight into the body because they didn't have all our CAT scans, MRIs, and everything else we have today to assess patients. But anyway, Dr. Valerie Taylor, I want to thank you so much for coming on the podcast and sharing your expertise. I will invite you back. Please let me know when some of the other research comes out because, again, this is such an important topic.